Truth is stranger than fiction. Did you know that you can die from only one ant bite? 1. Allergies can be life-threatening. On a hot July day, my mom and 2 older sisters were out walking down the street when my middle sister, Catherine, stepped into an ant pile. She was bit by one ant. Suddenly, she began to break out in hives and her head began to swell to the size of a pumpkin. My mom and sisters ran home. My mom called the pediatrician and he told her, "You don't have time to call an ambulance. Find a bottle of Benadryl and pour the whole thing down her throat. You can't overdose on Benadryl." So my mom followed those instructions and did that. Catherine's head, eventually her swelling went down and she felt better. That bottle of Benadryl saved my sister's life. Hi, my name is Clayton Borman. Being personally affected by the dangers of anaphylactic shock qualified me to educate you on the subject. I'm here to teach you about the dangers of anaphylactic shock. Knowing how to correctly use an EpiPen can be the difference between life and death, your life or the life of a friend or family member. First, I will tell you how to prevent death from anaphylactic shock. Then, I will tell you how to save a life. First, let's talk about how to prevent death from anaphylactic shock. Anaphylaxis is the sudden, severe, and potentially deadly allergic reaction involving the whole body. The 2 materials necessary are an EpiPen, which is this, which is a shot, and Benadryl, or an off-brand version of Benadryl. Now, let's talk about the steps to saving a life. These steps include recognizing the early symptoms, calling 911, and giving aid to the victim. Step 1, recognizing early symptoms. These symptoms include a sudden drop in blood pressure, dizziness and fainting, trouble breathing, hives, itchy skin, swelling of the skin or body, and a tingling sensation in your mouth or lips. Step 2, call for help. Dial 911. It's better to call 911 for a false alarm than risk death. Stay calm and speak clearly. Tell the operator of a possible allergic reaction. Give your location or address and request an EpiPen in the ambulance. Step 3, give aid to the victim. An EpiPen, like I said earlier, is a shot. It's an auto-injector. An EpiPen is your preferred treatment for anaphylactic shock. What you want to do is remove the EpiPen from the yellow box, and you're going to take off the blue safety cap. Hold it near the outer thigh of the victim at around a 90-degree angle. You don't have to worry about clothing because the needle will go through clothing. And you swing and you hold the needle in their body for 10 seconds, count slowly. Then you pull the needle out and you massage the area, the injection site, for 10 seconds in order to distribute the medication. If you don't have an EpiPen or there is no 911 service, what you're going to do is you're going to use Benadryl. Like my mom did with my sister, you're going to pour the whole bottle of Benadryl down the victim's throat because, as the doctor said, you can't overdose on Benadryl. Now you're going to position the body. Lie the victim on their back. Elevate their feet 12 inches and cover them with a blanket. Then you take them to the hospital. When you go to the hospital, you need to speak with the doctors and the nurses and tell them if you used an EpiPen or Benadryl, and if you did, give that to them. Anaphylactic shock can be incredibly scary. Knowing how to correctly administer an EpiPen is the difference between life and death. Remember to recognize early symptoms, call 911, and give aid to the victim, whether that be with an EpiPen or Benadryl. It only takes 1 to 2 minutes for a mild allergic reaction to escalate to anaphylaxis. Benadryl saved my sister's life. Who knows where I would be without her? Thank you.